abuse, harm, neglect. Abuse in the care home, different types of abuse you might see in the care home. So it's possible you go for interview question and you are being asked, what do you know about safeguarding? And you tell them, safeguarding is all about protecting the resident or your client from any form of abuse, harm, and neglect. And the next question that is coming is, what type of abuse? So yeah, I'm here to tell us the types of abuse we have in the care home. But first of all, we need to know what is an abuse, harm, and what? Neglect. So, what is abuse? Abuse refers to any action or behavior that somebody did intentionally to cause harm to a person. Abuse is any action, behavior that you did intentionally to harm somebody, to cause pain to somebody. You know, abuse can be physical, it can be emotional, it can be financial. There are different types of abuse you have. Abuse can also occur when there is a case of, imbalance in power. Like, when somebody is bigger than the other person. Maybe the way I might have somebody I'm supporting in the care home or in their home. I'm bigger than that person because they already have disability. Yeah? So, abuse can occur when there is an imbalance. Because, Now, what is neglect? Neglect is when there is a failure in the services or the care you render to people. The standard, like when there is a failure in the standard of care you provide to the service users. What do I mean? Abuse occurs when you neglect your responsibility. You don't do what you are supposed to do. You have to care for Mr. A. You don't do that. You just neglect them. Abuse can also be in form of, you have to give this person food. You do not give them food. You have to give this person shower. You didn't shower them. You have to, anything that you are supposed to do, a services that you are supposed to render to a service user, which is the client or the resident, but you did not do it. That is what? Neglect. Now we move to the next one, which is harm. Harm is the end point, the result of abuse and neglect. When you neglect somebody or you abuse them, the result will be what? Harm. Abuse plus neglect equals to harm. So, what is harm? Harm are those negative impact or injury you cause to somebody as a result of abuse or neglect. Do you get it now? There are those negative impacts. It can be physical injury, it can be emotional distress, it can be anything. The end point, the result of you not caring for this person and the result of you abusing this person is what? Harm. Now let's go to abuse and harm, or whatever, abuse in the care home. Let's go to abuse. Now, after you have answered safeguarding, by the time we finish this, you will understand how these three things, they are concepts that they interconnected in safeguarding. Abuse, harm, and neglect are interconnected. By the end of this teaching, you will understand why they don't take it easy. They don't take it lightly with anybody that have safeguarding concern. Now, in the care home, first of all, you have physical what? Abuse. You know what is physical abuse? It's a situation whereby you inflict harm on the residents or the clients you care for. How does it happen? When you hit them, maybe out of annoyance, you hit them. Is an abuse. You malhandle them. Maybe you are trying to give them personal care or watch. They are struggling. No, don't do this. You drag them. When you drag them, your hand, the picture stamps there. It is an abuse. Staff who does that should know that they are abusing this resident. Another example of physical abuse can be, when you are trying to support the residents with their continence support, which is their pad. You try to clean them, you have long nails. It's pinching on their body, on their skin. Reddish map is showing on their skin, on their bum is an abuse. I hope you understand what physical abuse means. Anything physical, they are seeing it. The mark of your hand is on their body. So we move to the next one, emotional abuse. This one, people do it. They don't know that they are doing it. They don't know the effect of what they are doing. Emotional abuse is a kind of, when you use verbal or non-verbal method, a kind of, your actions towards that person. For instance, this resident, they don't like to shower. They don't like to change their clothes. Now, the way you talk to them in front of other residents, in front of their fellow clients, you can abuse them emotionally. Can imagine coming out to tell somebody, you look so dirty, you are stinking, you are smelling, you've not showered for over 3 months, you've not changed your clothes for over 1 year. It's an emotional abuse. You don't do that. You approach them, they don't want to shower, document it, that is it, your back is covered. Leave them. Except you want to do best interest, you don't do it alone. You don't even say bad words to them because you want to do best interest. Okay? You have sexual abuse. Sexual abuse is when you touch them unnecessarily where you are not supposed to touch them. You are touching them. Maybe you want to change them. You are touching their breasts. You are tickling. You don't do that thing. If somebody else does that to you, you will not like it. It is an abuse. You don't do that. When you touch them in some places that is not, you touch them without dignity. You don't care. You spank their bum, you feel you can do it. You don't do that. It's an abuse. That is sexual abuse. Or even trying to do something sexual and get them to witness it. You don't do that. It's an abuse. We have financial abuse. A situation whereby you go and take the resident or your client's bank card because their PIN, they told you their PIN out of confidence or in confidence. You now go and withdraw. Maybe you have access to their phone and you delete alerts so they will not know. Or maybe they say they want to go shopping. You take them to the shop. You ended up stealing from them. You ended up taking what belongs to them, using their money to buy something you need for yourself, and you end up paying with their card, stealing from them, taking their clothes, their shoes, going to their toilet and bathroom, taking their toiletries. It is an abuse because they buy those things with their money. Now, how about neglect? Neglect is a situation whereby what you are supposed to give to this person, you don't give to the person. You're supposed to give them food. You don't give them food. You're supposed to shower them. You don't shower them. You don't even try. You don't give them clothing to put on. You neglect them. You leave them. All these things are abuses that happens in the care home. So in case you go for an interview and they ask you from safeguarding to abuse, they ask you what type of abuse can you see in the care home, all these things I've listed are the types of abuse that is possible in a healthcare setting. I hope you love it. I hope you learn from it. So please do well to subscribe. If you like what we are doing, subscribe. leave a comment for us in the comment section. Share it so that other people that needs this information will have the information. And please, if you are into care, you want to go into care, remember you need this information, because when you go for interview, it's not just all about cramming it. Listen to what I have said, understand it, and put them in your own words. If you have any question, you can put in the comment section. I'm ever willing to do what? To answer. If you have any scenario interview question, or you have been to several interviews, you don't know how to answer it, write them in the comment section. I will teach you how to answer it, and surely you will pass. Okay?